All right, well, let's jump in. Hello, everyone. My name is Rhonda Fisher. I am the clinical program lead for team training here at the AHA, and welcome to our July webinar on Work Your Way, addressing nursing staffing challenges through alternative staffing programs. I'm super excited about the webinar today. It really meets a felt need that so many of you are addressing out there in your organizations. So without further ado, let's get started. Before I hand it off to our speaker today, I am going to go over a few rules of engagement. So first of all, you can access audio by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. Please note that you are in listen-only mode throughout the presentation today. I will moderate a Q&A session at the end with our speaker. So if you have a question, please just chat it in throughout the presentation and I'll be watching for those, and we'll get to that during our question and answer time. If it's a technical or logistical question, however, we'll answer that in the moment. But if it is for our speakers, again, we'll save it for the end. Finally, we do want you to be aware that this presentation is being recorded, and we will notify all registrants when the recording is up on our web. All right, exciting. We do offer continuing education credit for our webinars. In order to claim your CE credit, you must create a Duke OneLink account. You only need to create an account once. You can use it for all future webinars, but you will need to do it if you have not done that before. So Kara will be chatting in some instructions, or you can find that in your registration confirmation email. Following the webinar, you're going to want to text that TENYEK to the number that you see there on your screen, and we'll pop this information up for you again at the end. So don't worry if you don't catch it all right now. Do want to let you know about some upcoming team training events. Hooray, our Fall Master Trainer course registrations have opened. You can access more information and registration links there on the slide. We always encourage people to attend with a small team since we've made a lot of enhancements to the course, including human-centered design thinking, so that you can work with your actual team and walk away with real strategic and tactical plans for your team steps implementation. So do encourage team attendance. Also want to let you know that we are super excited. You'll see there under the in-person Team Steps Master Training that we are going to be offering a Team Steps refresher course. We know that you've been waiting for this, so we're excited to be piloting that this fall in the month of October. So that 4-week virtual course is designed for those who have taken a previous Master Trainer course, but need to refresh their skills, get current with curriculum updates, or perhaps jumpstart your program's implementation plan, particularly if it had to take a little hiatus the last few years because of the pandemic. So we're super excited about it. Space is limited, so you're going to want to register for that right away. Also letting you know that we have a couple webinars still coming up this summer. We have 2 in August. August 9th is a webinar on healthy aging, how to leverage interdisciplinary collaboration to create age-friendly health systems. That's going to be a great and super relevant webinar for all of us as we seek to address our aging population. And then we'll have another Relia-sponsored webinar coming soon, August 16th. So stay tuned for more details on that. So lastly, if you're looking for a more customized training solution, we do offer on-site trainings where we come to your organization to deliver anything from a 2-day Team Steps Master Training course to a comprehensive training program that spans multiple on-site training, has virtual coaching, so we can truly support your Team Steps implementation efforts in that attempt to foster ownership and sustainability at your organization. We can completely customize those services, so that makes it a really great option for organizations that want a little bit more specified customization. So you can visit our website to learn more, complete a brief questionnaire, and one of us will get back to you just as quickly as possible. All right, so with that, I would love to introduce our presenter today. Her name is Alicia LaPalambara. Alicia currently serves as the Director for Network Nursing Operations on the Executive Nursing Team at Allegheny Health Network. Prior to her current role, she spent 2 years in the Strategy Office at Highmark Health. She holds a BA in Psychology from Kenyon College and an MS in Healthcare Policy and Management from Carnegie Mellon University. She also completed a postgraduate administrative fellowship at Johns Hopkins. Not an overachiever or anything, are we? So she is super passionate about improving the health of communities, simplifying complexities, and creating a healthcare system that works for everyone. And of course, we love to point out the fact that she is a previous fellow from the Next Generation Leaders Fellowship that we do here at the AHA. And this particular webinar stems from the capstone project that she completed during her program year in her fellowship cohort. So Alicia, super happy to have you, excited about what you have to bring to us today. So let's get to it.
Thank you so much, Rhonda. Hi, everyone. I am really excited to be here with you today to share with you some of the work that we have been doing to address the nursing staffing shortage. I know a pressing issue for all of us. So our objectives today are, I'm going to walk you through the approach that we took to meeting the really varying lifestyle needs of our nurses, both from their own career and personal life standpoint. The different staffing programs, particularly looking at employee engagement and retention. And finally, taking a look at the progress that we've made to date. This is still very much a work in progress. We are continuing to shape these and other initiatives, but we'll take a look at our progress to date and evaluate the initiatives and talk about a few lessons learned as well. So to begin with, I'd like to take a step back here and just frame the problem that we're facing. As everyone on this call is likely very familiar with, this nursing staffing shortage is a vexing problem with some really far-reaching implications. Financially speaking, there is a tremendous cost and burden created by the staffing shortage that really can't be overstated. The average cost of bedside turnover for one nurse is $52,350. That represents a 13.5% increase from 2021. So not only is our turnover increasing, cost associated with it is increasing as well. This turnover is causing an average hospital to lose $6.6 to $10.5 million annually, with the average landing at $8.5 million in 2022. Each percentage change in turnover can cost or save the average hospital $380,600 a year, while every nurse hired has the potential to save an average of $157,000. We know that labor expense is the top budget line item, and this represents an enormous cost savings opportunity. So our greatest opportunity to improve our margin is really to take a hard look at reducing those labor expenses. The staffing shortage, while it does have an enormous financial impact, is costing us more than just dollars. There is a real human impact here that shouldn't be overlooked and that I want to just take a moment to ground our discussion in. A 2020 survey conducted by the American Nurses Association found that 62% of nurses reported burnout in 2020. That's more than half of our nursing workforce feeling burned out by the job. Additionally, research indicates that hospitals with higher patient-to-nurse ratios have poorer patient outcomes, up to and including higher rates of mortality. So this is a costly problem in more ways than one. And diving a little bit deeper here into the vicious cycle of turnover, I just want to address some of the factors and the process that we find ourselves a bit stuck in here. So there are numerous internal and external factors that are driving nurses to leave the bedside. The staffing shortage is sort of the overall issue we're talking about here, but we have deep frustration over compensation. We have nurses who are feeling a lack of respect from other clinicians, from administrators, from colleagues. We have high levels of burnout, as we discussed, and workplace violence is on the rise. A 2022 study found that 44.4% of nurses reported experiencing physical violence on the job, while 67.8% reported verbal abuse. These are really staggering numbers and are a big contributor to a challenging environment that our nurses are coming to work in. So that's the internal piece, but at the same time, we have some really powerful external factors as well that are driving this turnover. So for nurses who are able to travel, it's a pretty enticing offer. Travel rates average $127 to $175 an hour, with some specialty areas getting as high as $200 an hour. And we also have shifting labor market forces. There are a lot of non-bedside opportunities for nurses. There are outpatient opportunities, telehealth opportunities. There are opportunities at insurance companies, lots of healthcare startups. And so for nurses who are fatigued by the environment at the bedside, there are a lot of opportunities to go elsewhere. So this is leading to departures, which leads to an increase in our vacancy rate and a big strain on our staff who remain at the bedside. Their patient ratios go up, overtime increases, the need to pick up extra shifts increases. In areas where there's a call requirement, those staff end up having to take call more frequently than they did previously. At the same time, the average time to fill a nursing vacancy is increasing. As of 2022, it was 95 days on average, which is an 8-day increase from 2021. We are not able to operate our hospitals with high vacancy rates, and so this forces hospitals to take costly, short-term, and unsustainable solutions. One of these is filling vacancies with expensive travel nursing contracts, but it also results in increased overtime pay, double and triple incentive pay to get nurses to pick up additional shifts. And these nurses are already, as we know, experiencing symptoms of burnout. This doesn't leave any money for our hospitals to focus on really hitting those underlying issues that would address turnover and give us longer term solutions. And additionally, our staff who remain with us grow more and more frustrated as they see these high dollar agency nurses come in and work side by side with them, doing the same work. Our own nurses often having to spend time helping to orient them to the unit and to the hospital, all while knowing that they're making significantly more money than they are. For every 20 travel nurses that we are able to eliminate, hospitals can expect on average to see $3.14 million in savings. Think about that. By hiring just 20 nurses, we could see an average of over $3 million in savings. Now, as we all know, this is easier said than done, but there is an enormous opportunity there. Lastly, I want to just drill in here on our vacancy rate. So in 2022, the national vacancy rate for nurses was an average of 15.7%. And bringing this home further to what we experience here at Allegheny Health Network, in 2019, prior to the pandemic, our vacancy rate was 12%. By 2022, this had grown to a staggering 34%. And so there is a real burning platform for us to solve this issue. And I know that those on the call are facing the same challenges with turnover. So now that we have discussed the problem, I want to share with you the approach that we took to framing our solution. So in developing proposals for how to address this challenge, we knew that it was really critical to involve direct input from our nurses so that they felt included in and supported by the solutions that ended up being put into place. And so we included their input in a variety of different means. We have a yearly clinician wellness survey that we administer along with an employee engagement survey where we get really valuable feedback from our staff. We've had engagements both with internal and external consulting companies that have allowed us to do crowdsourcing with our nurses, have given us opportunities to really hear from a handful of bedside nurses from across the network about the challenges that they see. And we've done mediation sessions with them on solutions that they feel would be beneficial. Our leaders do rounding constantly on the units to hear from staff. And we at the executive nursing level meet regularly with our nurse leaders to hear feedback that they're hearing from their staff. So all of this really helped us drill into the specific areas that we wanted to be solving for. One of the big needs that emerged from all of this research is that our nurses have lifestyle needs that vary at different points of their careers and their lives. We have nurses who are just out of school. We have nurses who are caring for young children. We have nurses who are caring for young children and aging parents. We're accounting for generational differences within our workforce. One of the things that we heard a lot, both from young nurses in this newer generation of nurses, but across the board, is that rotating shift work is a real challenge. Having to work some nights and some days works for some nurses and is a major dissatisfier for others. And we do know from the research that there are health implications to that type of rotating shift as well. Sleep disturbances, potential chronic health issues, as well as just a major disruption to social lives, family lives. So that was a theme that we wanted to solve for as well. Addressing the labor trends that we spoke about previously, aftermath of the pandemic, which we see largely in burnout among our staff. And when we set out to solve this problem, we had over 700 travel contracts with nurses. And so this is sort of a recap of where we took a look to come up with solutions. And out of this, the proposal for the Work Your Way program was born. The intention for this program was to present our nurses with a variety of options for working in our hospitals, present them with things that would hopefully keep them with us rather than leaving for some of these alternate jobs within nursing, including travel positions. And we really wanted to create some flexibility for them that matched their lifestyle needs and meet our nurses where they are, rather than just doing things the way that we have always done them, because as we all know, that is not working for us anymore. So there are a couple of different components of this program that we proposed. The first is what we dubbed the Night Owl program, and this is a steady night shift program. So the idea here was multifaceted. We wanted to create an opportunity that did not involve rotating shifts. We also wanted to take a look at how we could fill some of those more difficult to fill shifts. We were spending a lot of money on overtime, on incentives, on agency to fill those difficult to fill shifts. And so the proposal here is for this program to be straight nights. So all of the hours worked by individuals in this program would be between the hours of 7 p.m. and 7 a.m. This was open to full-time, part-time, and casual staff. And we made a pretty significant increase to the shift differential paid, depending on the role. So as you can see, we included RNs, LPNs, patient care technicians, respiratory therapists, monitor techs, and unit secretaries. And they, depending on their role, had either a $3 or a $5 an hour shift differential compared to an existing $1 to $2 shift differential for working the night shift. So this was proposed to be an increase in the shift differential only for those individuals who elected to move into one of these positions that was steady night shift. So those who remained on a rotating shift would keep the lower shift differential when they were working night positions. The proposal was also to allow these individuals, if they wanted to pick up overtime, that they were certainly welcome to do so on a daylight shift, but that their full FTE hours would be part of the night shift program. And a really important component of the way that we framed this is that this was intended to benefit everyone. So by moving individuals into a steady night shift program, we should be able to free up our rotating staff to work fewer nights. This was intended to be a program that was rolled out FTE neutral, meaning we were asking our units to convert existing recs that they had or close recs to move people into these positions or to post externally with a night position rather than a rotating position. So this was component one of the Work Your Way program. The second component was dubbed the Weekend Warrior program. And this is a straight weekend program available to the same group of employees. And this is from Friday at 7 p.m. to Monday at 7 a.m., looking for 24 hours. So this is a 0.6 FTE, but they are given full-time benefit. This is a flat rate role, so there's not a shift differential associated with it, but there was a proposed increase for these roles that, again, was either a $3 or a $5 increase based on the role that they were in. Same structure and idea here, that if we were able to move enough individuals into the weekend program, individuals who remained in those rotating roles would have fewer weekends to work. Working with our CNOs, we estimated 50% participation in these programs, meaning that 50% of our night shifts and 50% of our weekends would be covered by individuals in those roles. And the ROI was really built around reducing turnover in our own employees and being able to cut down on some agency costs. The final component of the Work Your Way program is our internal staffing team. And when we first proposed this, we had two teams in mind. One team that would service the peri-op team and be made up of nurses and surge techs, and one team that would service the inpatient units that would be solely nurses. All of the positions within the internal staffing team were proposed to be full-time, and the initial proposal included regions. So 3 to 4 hospitals per region, a nurse or a surge tech would be hired specifically into that region and travel on a 6-week assignment to the hospitals within that region. The proposal included a slightly different compensation structure for the inpatient versus the peri-op teams. So the nurses in the inpatient team had a base rate of $65 an hour with a flexible supplemental rate that, when we proposed rolling out, would be set at $20, but would give us a little bit of financial cushion that if in the future we saw external travel rates go up or come down, that we could toggle that supplemental staffing rate to adjust and still have this be a financially sustainable solution. Our peri-ops to match market rate were put in the proposal at a higher rate of $85 an hour, with the surge techs at $65 an hour. There was mileage reimbursement, lodging included, as well as a sign-on bonus for these positions. And for the inpatient areas, we had designed 3 different teams. So one would be med-surg and telemetry, the second would be critical care, and the third would be emergency. And the intention with this team was to really be hiring experienced nurses. And we wanted to make sure that in creating this solution, we had a way to ensure that we weren't robbing Peter to pay Paul, so to speak. We wanted to make sure that we weren't going to be hiring nurses from our own inpatient units, creating vacancy on those units, and then paying them a higher rate. And so we worked really closely with TA when we got to the point of rolling this out to come up with some ways to avoid that. But before we got to the point of launching these programs, we wanted to make sure that we had, or that we would have, buy-in from our staff. And so we took these proposals and we put together a survey that we shared with everyone who would have been eligible for the programs to ask for their feedback. Did they think that these programs would be valuable? Would they help with retention? How did they feel about the idea of these individuals making more money? And what would their likelihood of leaving the organization be? So in looking at the night shift program, we had 68% of our nurses who somewhat agreed or strongly agreed that a steady night shift program would help with retention. 74% of them strongly or somewhat agreed with paying those individuals a higher shift differential. And just over half felt that they would be somewhat or very likely to stay at the organization if this program rolled out and they themselves did not participate in it, but as a result of the program, they had to work fewer nights. We saw even more positive feedback from the weekend program, with 71% feeling that it would help with retention, 82% agreeing with that higher rate, and 70% saying that they would be likely to stay at the organization if they had reduced weekend shifts as a result of these programs. What we did see is that the internal staffing teams had more of a lukewarm response. Just over half of our survey respondents felt that it would be extremely or moderately valuable. And so we really took this feedback to heart. And we moved forward with the steady night shift and the weekend programs, and we hit pause on the internal travel team. And we took a really hard look at the feedback that we were given. We also wanted to really make sure that our nurses understood that we were listening to them. And a lot of what we had heard throughout the research that we did throughout this survey in general from our staff is that they didn't feel they were being compensated fairly. And so simultaneous to the work being done with these programs, there was a lot of work going on in the background with our compensation team. And so there was an important market adjustment made for our nurses as well. So with their feedback in mind, we worked with our marketing team to create a really robust internal campaign. These posters on the right here were hung all throughout our hospitals, and we moved forward just with the night and weekend programs initially. So in March of 2022, we rolled those two components of the Work Your Way program out. And then with additional feedback and rework, including the elimination of the regions and an adjustment of some of the assignment length, we were able to roll out the peri-op internal staffing team in August and the inpatient internal staffing team in October. So now with, So now with a little over a year of the nights and weekend program having been in place, and not quite a year since we've rolled out our internal staffing teams, we do have some initial outcomes to share, and I'm excited to go through those with you. As I mentioned, this is still very much a work in progress, but we have seen some early results that we're encouraged by. So taking a look at our burnout here, this data comes from the clinician wellness survey that I mentioned we've been doing here at our organization for the last 4 years. We are actually about to get our 5th year of data back from this survey. But as you can see with our bedside nurses over here on the left, we were seeing a really steady increase starting in 2019 before the pandemic and steadily increasing until 2021. As I mentioned, in early 2022, we launched the first components of this program, and the clinician wellness survey was taken in mid-June of 2022, and we saw a pretty significant decrease in our burnout for our bedside nurses from 67% to 54%. Now, that is still more than half of our nursing workforce reporting symptoms of burnout. So there is much work to be done here still, and that number is higher than we would like it to be. But it's certainly progress in the right direction. And for our nurse leaders, we saw similar progress, and we saw nearly a return to our pre-pandemic levels of burnout. Again, much higher than we would like to see, but we are proud of the work that was done here, and we're proud that our burnout rates for our nurses are below the national average. Taking a look at our turnover, bit by bit, we are seeing our turnover decline. The movement at the bedside is encouraging. Since 2022, where we implemented these programs, we have seen a decrease from 22% of turnover to year-to-date 18% turnover at the bedside. A big area of opportunity for us continues to be our first-year turnover. So while we have seen an important decrease from 2021 to 2022, as well as 23 year-to-date, this is still an area where we are not hitting the goal that we would like to be hitting. And so as we move forward with this and other programs, this is a really important area that we'll be continuing to hone in on. So speaking a little bit about the progress of the Night Owl and the Weekend Warrior program, when we rolled these programs out to the 6 initial roles that I mentioned, there was very rapid interest from many other roles within the organization to be included in the program. And so in a few different phases, there have been numerous other positions included in the program. If you recall, we had a goal of having 50% of our night shifts covered by Night Owl employees, and we have very nearly hit that goal. We continue to be below our goal with the weekend program. We have extremely positive feedback from individuals who are in the program, as well as from the managers who oversee those employees. But the participation is a lot lower than we anticipated. We see about 20% participation in that weekend program. And so we are spending some time moving forward to take a look at that program, hear from employees about areas for opportunity, why employees might not be joining it, and address some of those issues so that we can hopefully improve the program. To date, we have over 1,000 employees who are in one of our Work Your Way positions. And our turnover rate is really low for the individuals in these positions. It's just about 3% turnover for individuals who have taken one of these night or weekend programs. This doesn't include a really small number of individuals who have taken a night or weekend position and then determined that for lifestyle reasons, they actually preferred to be in a rotational program, and we had the ability to move them back into one of those regular non-Work Your Way positions. Taking a look at the outcomes from our internal staffing team, we've seen some great savings associated here. Year to date with this team, we've seen $2.3 million in savings, and this is directly associated with over 20 agency contracts that have not had to be extended. Our recruitment has performed better for this team than for our regular bedside roles. When we initially rolled the program out, we had approval for 50 positions, and based on the success of recruitment for that team and how valuable they became to our hospitals, we increased the positions within the internal staffing team to 200. And as of right now, all of those positions are filled. As I mentioned, we had concern about ensuring that we were adding to our FTE total and making sure that we were not just cannibalizing our own units. And we've had really good success with that. We have 86% of the hires for that internal staffing team having come from external to our organization. And notably, we've had some rehires. We left and have kept track of the nurses who have left our organization to travel, and we were able to recapture 27 of those individuals, as well as 4 employees who had left to travel and remained casual with us, who we were able to convert back to full-time. And our time to fill for these positions is significantly lower than our bedside, so we are seeing less than 60 days to fill these positions, or we were when they were open. Finally, taking a look at retention for this team, similar to our other Work Your Way positions, we have a 3% turnover rate for our internal staffing team, and this includes both voluntary and involuntary turnover. So we do have a small number of individuals on this team who have converted from the internal staffing team to a unit-based position, and this is what we like to call the best possible kind of turnover. We have a couple of individuals who have rotated and really loved one of the units that they've rotated on, and they've decided they'd prefer not to travel and they'd like to have a home base in one of our units. And what we always talk about with the director of this team is that really is our goal. It's a great recruitment tactic to bring individuals in through the internal staffing team and help them find a home within our organization on a unit when they're not interested in traveling anymore. So we look at that as a big success. And we have revised over the last 6 to 9 months that we have been working with both of these internal staffing teams. We've revised the assignment process. They are on 6-week assignments. We have varying levels of technology that we use across our systems. Some of our hospitals are much more adept at using Kronos, our scheduling system. Others are not as far along with it. And so we have a fairly manual process right now for scheduling, and this is one of the areas that we are continuing to focus on and evolve. But the director who now oversees this team works very closely with the team that handles all of our external agency contracts. And so every 6 weeks when the schedule is being made, we meet as a team and we ensure that we are eliminating agency contracts wherever possible. So if we have a unit that is coming to us and saying they need an agency contract, we're really taking a hard look to see, can that be filled with someone from the internal staffing team? Even if that means moving them from their current assignment at a hospital, we're doing everything that we can to be filling those positions with our internal staffing team before we're turning to agency. And we've seen some positive movement here. We have still a high number of external agency contracts, but we are seeing a declining usage of those external agency nurses. Simultaneously, an increase in the usage of our own internal staffing team. So we, for this past month, budgeted a mix of our travelers to have 10% of all travelers be made up of internal staffing team with 90% made up from agency, just based on the needs that we've had. And we were able to exceed that with 15% of our travel pool coming from our own internal staffing team. So as we continue to bring down our agency usage, as we start to see agency rates coming down, we are also looking to the point that we are able to adjust that supplemental staffing rate that I mentioned. We want to make sure that we're doing it at a time that it coincides with a decrease in external rates so that we don't start to lose our own internal team. But this is a really careful balance that our team works on of managing the volume from both external and internal travelers. And I just want to share with you some of the anecdotal feedback that we've heard, because I think that this is important in hearing the voice of our nurses. So just a few comments that we have received from nurses who have participated in the program. Working night shift has given me an opportunity to be more present in my family's lives, and it recently has given me a chance to help care for my aging mother. Having the ability to work weekends provides the opportunity for my family and I to have frequent game and movie nights during the week, and this also allows us to have sit-down meals 5 days a week. The impact has been life-changing. I'm able to schedule work around my life instead of my life around my job. And finally, there is a different feeling or a buzz in the hospital over the weekend. I enjoy working weekends because I have more time with patients and I'm able to see them interact with their families. It allows me to connect with my patients on a deeper level. We have numerous comments from staff who are in these programs. We've diligently followed up with them. We've had them take surveys. We've interviewed some of them for internal newsletters that we've published. And these sentiments are really echoed by the individuals who have moved into these work your way positions. They really are hitting on the theme that we intended to address here, which was meeting them where they are in their own lives and providing flexibility that matches their lifestyle needs. So some nice feedback from our staff that we are really pleased about. So finally here, I'd like to take a look at some lessons learned. One of the biggest lessons that we learned early on here was about not working in silos. So we, as the executive nursing team, we're so focused on the nursing shortage, but as we all know, there are staffing shortages in other areas in our hospitals. As I mentioned, when we rolled this program out to a small component of the nursing care team, there were individuals across the organization who said, I want to be a part of that program too. And so thinking through the ways in which we can engage other stakeholders outside of the nursing org earlier on in the process to say, here's something that we're developing. Would you like to partner on it? Is there interest across the organization? So that was a really valuable lesson to hear to us. 4 of our hospitals have unionized nursing workforces. And so this was a challenge that we worked through with this program. There were many different approaches to the unions to negotiate the details of these programs. And a lesson that we learned from that, similarly to the last, is that the various bargaining units really wanted everyone, all roles who sat in those bargaining units, to be included in the program. And so figuring out how to balance the finances of that, the ROI associated with it, is an important lesson learned as well. I mentioned that the intent for these programs was to be FTE neutral. We wanted to ensure that rather than adding a bunch of night and weekend positions to their budgets, our managers were working with their directors of finance to identify recs that they could close and replace with the night and weekend positions. That was a confusing process for a lot of our managers. And so it did give us an opportunity for our directors of finance to work really closely with them and help to understand some of the nuances in the budget, and gave us insight into future programs that we might roll out and education that we need to do around that. Finally, this was a really complex rollout. It involved the creation of new positions, coding of different pay practices. And so just the lesson learned here of figuring out all of the right stakeholders to involve and making sure that everyone is engaged early to make for a smooth rollout was a really important takeaway for us as well. And lastly, what I want to touch on here that Rhonda said at the beginning is there's no silver bullet solution to the staffing shortage. So while we are really excited about some of the progress that we've seen, we know that it is not solely because of the Work Your Way program, and we know that this is not the solution that is going to solve the staffing shortage for us. We have numerous other initiatives that have taken place over the last few years and that continue into the future. We accelerated our merit increases so that every employee received their merit increase a full quarter sooner than they had in years past. As I mentioned, we made some market adjustments. We rolled out a paid parental leave policy, as well as a graduate nursing loan repayment policy. At our non-union hospitals, we were able to increase wages for our LPNs. We have a large ongoing project called Reimagine Nursing right now, which is really taking a look at how to reduce some of the burdensome tasks associated with nursing and return the joy to practice. Our nurse leaders spend a lot of time doing gratitude rounds on the units, thanking the nurses and making them feel seen for the work that they're doing. We ran a mentorship pilot to provide support for our new nurse managers. We have a book and journal club that our nurse leaders lead and any nurse is able to participate in. And there are many other initiatives here that I don't have the time today to mention, but we will not solve the staffing shortage with one solution. And it is going to take a lot of creativity and thinking outside of the way that we've normally done things in order to continue moving the needle here. But we are really encouraged by the progress that we've seen and the positive feedback that we've heard from staff, as well as from the managers who oversee staff in these positions. So to conclude here with some key takeaways, including input from the nurses and the individuals who will benefit from solutions is really critical to the success of those initiatives. And showing them that we are listening to their feedback and tweaking our plans based on their thoughts is really invaluable. As we just discussed, there is no one solution to this, and it will take numerous combined efforts. And finally, seeking creative solutions that meet our nurses where they are and really value them as individuals outside of being employees, looking at where they are in their lives and in their careers, can really positively impact recruitment and retention. So with that, I would love to answer any questions.
Okay. And yes, we've had a few of them firing up in the chat. So not to mention my own. So I'll try and give some precedence to people who show up in the chat first. But I thought this was really an excellent presentation, Alicia. Thank you so much. I have been an ER nurse for 31 years myself. And am one of the statistics that left the bedside to go do something completely different after the course of the last few years. So I really appreciated the points that you had to make and the efforts that your organization is making to really shift their paradigm on staffing for nursing. So going to some of our questions. So one question we had was, did the Weekend Warrior program include a higher pay rate or just 0.6 FTE and full benefits?
Yes, it did include a higher pay rate. So for each of those roles, we looked at the average pay across our system and increased that by either $3 or $5, depending on the role. So for our RNs, LPNs, and respiratory therapists, that was a $5 increase from that average base rate. For the other roles, it was an average of $3 increase.
Okay, great. And could you speak for a moment to, did you incorporate any partial shifts? Like, did you hit the need of nurses desiring, for example, only 6 to 8 hour shifts as opposed to working 12-hour shifts? Like, was there some flexibility and given there? Or were these programs essentially just full-time equivalents?
It's a great question. So the night and weekend program were open for full-time, part-time, and casual nurses. And so within that, we do have a variety of 12-hour, 8-hour, 4-hour. One of the areas that we'd like to go in the future is looking more at creating some of those different length shifts, because we are primarily on 12-hour shifts for most of our units. But for the night and weekend program, it was open to full, part-time, and casual. So there is some variability in shift length. For the for the internal staffing team, that was only open to full-time employees. Again, some variability in shift length, although they are full-time employees, but the majority of them do work 12-hour shifts.
And you said that was for your internal staffing team?
Yes.
So just a point of clarification, your internal staffing team, that was the equivalent of creating essentially your own internal agency. Am I correct in saying that?
Yep, that's exactly right.
Okay, and that is, again, one kind of met with you did move forward with that, even though that was kind of met with a little bit more, I don't want to say the word resistance, but not every nurse was like applauding that particular one.
Yeah, so we did take some time to revise the structure of it a bit. I did see one of the questions pop up in the chat about how large our health system is. So we are a 14 hospital health system, but we are primarily located in Western Pennsylvania. And so the regions, part of the feedback that we heard, the not positive feedback that we heard on the initial plan, is a lot of our hospitals are not that far apart. So some of our regions that included 4 hospitals might only include a half an hour drive time from anywhere that you might be going within that region. And nurses didn't feel that that justified the increased rate. And so we did end up dropping that regional component entirely, because the majority of our hospitals are certainly not an overnight commute.
Great. What specific strategies did you use to avoid filling the internal staffing team with existing employees? Yeah,
that's a really good question. So a lot of the strategy here that we worked with on with our human resources team was in the way that we crafted the positions and making sure that we were really looking for We had a minimum requirement of 2 years of experience for these nurses, and a lot of our workforce right now is very young and just doesn't have that level of experience. So that did help to create a little bit of differentiation. Another helpful component of this is, this was a bit of a gamble that we assessed with our nurse leaders, but there was a strong feeling from a lot of our nurse leaders that if someone were going to leave to travel and be interested in having that type of schedule where they didn't have a home-based unit, they would have likely left already. And so structuring it in such a way to make it, I don't want to say less attractive, because the idea is for these different programs to appeal to different individuals, but making it a little bit more of a demand for what this team would be doing. So dropping the regions, for example, saying that they would need to be willing to travel to all of our hospitals. A couple other things that we included, they're not eligible for double or triple incentive. So a few ways that we've differentiated and sort of taken some of the things that our unit-based staff are accustomed to and not making them a component of this new position was another part of the strategy for targeting external candidates.
Okay, great. And on that subject of external candidates, hiring bonuses.
Yes.
Boy, that's a mixed bag.
Because
you want to use it to draw in external hires, but at the same time, boy, that is a gut punch to the morale of your frontline workers who have been determined to stick it. So how did you handle that?
Yeah, so this is a tough pill to swallow, and I think that this is something we continue to struggle with. We have sign-on bonuses right now for our unit-based positions, for our internal staffing team, and something we hear a lot from our existing staff is, what about retention bonuses? What about something for the staff who are still here? And so I wouldn't say that we have nailed the solution on this. We keep our sign-on bonuses to be competitive with the other hospitals that we compete with, but taking a look at ensuring that we were increasing our rates to be competitive, moving those merit increases up, offering some bonus opportunities that we did a couple of rounds during the height of the pandemic and staffing shortage. So finding some ways that we can extend, we have referral bonuses for any nurse or any employees eligible for a referral bonus if they bring a nurse into the organization. So I wouldn't say that has solved the issue, but it's definitely something that is at the forefront of our minds that we know is a hard pill to swallow for our nurses.
Yeah, good. Let's see here. There was another question of, do you have any similar staffing plans that include ambulatory staff?
We don't currently. Our peri-op internal staffing team does sometimes send staff to our ambulatory surgery centers. That's a little bit more of an unofficial component of that team right now, but it's something that we do plan to take a look at. The greatest need for us in terms of staffing was on the inpatient side. For a lot of those lifestyle reasons, in the ambulatory space, it's easier for us to recruit and retain staff. And so the key area of focus initially was inpatient, but there's certainly interest from our ambulatory staff in some areas.
Great. And then just a question on, here's another one that just popped into the chat. How have you managed nursing staff with home care?
So home care in our organization is actually handled by an entirely separate team who we do work a bit with, but it's not something that I have oversight of in my role.
Gotcha. Okay. And then certainly a lot of the buzz that you hear out there is moving back to a model of team-based nursing. So are you doing, how are you staffing your units? Are you mainly staffing and recruiting RNs? Are you trying to recruit just as many LPNs and aides and, such as that, maybe techs and the ED to create more of that team-based approach? And how is that going? Or if you...
Great question. So we have been working on a team-based approach that we have called our blended nursing program over the past couple of years, doing exactly that. We have been looking to increase our LPN hiring. We, like many other hospitals, trended towards only hiring BSN nurses, and in recent years have sort of moved back towards saying we need to go back to a team-based approach and increase our hiring of LPNs. So we have about 40% of our units across the system that are using this team approach. We, in the last 2 years, have hired, I believe, 80 LPNs to help with that effort. There's certainly continued recruitment effort to hire more LPNs, but we've seen some really positive patient experience, quality outcomes, employee engagement outcomes on units where we're using that blended model, from simple things like the team being able to cover for each other so that everybody can use the restroom and get a drink of water and take a lunch break. But those things really matter, and those are areas that come up in our clinician wellness survey a lot. And there's a big ROI there. When we look at replacing some of our open recs for RNs with LPNs, there's a really significant savings opportunity there. And particularly when we look at replacing some of our open recs with LPNs instead of travel nurses, there is an opportunity if we look at having 80 LPNs versus 80 of those roles filled with other types, there is really potential for some significant labor expense reduction. So we have definitely embraced the team care model. We continue to roll it out at additional hospitals, but in about 40% of our units, they are using and really appreciating the outcomes that they're finding from that model.
Great, thank you.
Yeah.
Well, we just have a couple minutes left. One last question that you can really, I think, answer quickly, because I think you touched on this. What shifts qualify for the weekend warrior? Is it Friday night shift to Sunday night shift, or does it extend earlier Friday or later Monday?
Yep, it's Friday from 7 p.m. through Monday at 7 a.m. And within those hours, they are required to work 24 hours. So most of them work that as 212s.
Okay, all right. So lastly, just want to let you know, Alicia, that you've been getting lots of great buzz in the chat. People love what you're doing. So congratulations there, not only on the great work you're doing, but also on a great presentation. And you have lots of them out there wanting to know if you're willing to share your, like the surveys that were sent to the nurses and regarding to how they would feel about these changes. And also the questions you asked of your staff in your rounding sessions to get this feedback to start the development of Work Your Way. So is that something that you're able to share, those things?
Yep, I would be happy to share those.
Okay, great. So we'll work on making sure that we get that out there for you guys. All right, so lastly, just wrapping up here, trying to get the screen there. Oh, there's your references, always important. So fiddle-dee-dee.
Oh, sorry.
That's okay. Did you steal control back from me?
That might have been me. I was trying to read the chat.
No problem, no problem. Do you want to just go forward to the very last slide, Alicia, about what they need to, there we go. Final reminders. So evaluations, please complete the evaluation form that appears on your screen once the webinar ends. Those are super important to the presenter as well as to us here at AHA. So if you could just take a few moments to do that, we would really appreciate it. Don't forget that you can get CE credit for this webinar, so make sure that you create your Duke OneLink account if you have not already done so. And there's the instructions there on the screen once again. So thank you for joining us, everyone. We're so glad that you made the time to do that. We know that it was super helpful, encouraging information that, again, we haven't landed that silver bullet, but we're on our way to innovative solutions. And that's great news for all of us. So, all right, everybody, have a great afternoon, and thanks so much for joining.
Thank you.